The strategies for safe movement of patients as shown in this video are general in nature. They can apply to many types of patients, but may need to be modified for certain diagnoses, impairments, or precautions that a given patient might have. Thus, for a specific patient, the strategies shown may need modification. If you are unsure of how to safely move an individual patient, it's recommended that you consult with the occupational or physical therapists at your facility. Whenever assisting a patient with movement, it is important to instruct the patient in ways that they can assist with the movement. If the patient knows what to expect because you are communicating with them, they are less likely to move in a way that may come as a surprise to you and throw off your own balance. Also, instructing them how to assist helps promote their independence in completing the movement and makes your job easier, as you may not have to provide as much physical assistance. This video is going to demonstrate how to transfer an individual from a bedside chair to a bed using a standing pivot technique with an assistive device. This technique may be useful for someone who has weakness in their legs or who may need some assistance with balance during the transfer. A wheeled walker will be used in this video, as it is a common assistive device used by older adults. For this transfer, the chair may be positioned a bit further away from the bed than it was for the stand pivot transfer without an assistive device. The rationale for this is to allow the patient room to maneuver the assistive device. However, you still want to try to minimize the distance that the patient needs to travel to maximize the patient's safety. If your patient is known to be able to bear weight fairly well and can even ambulate, it may not be necessary to have the chair this close. However, the medical and therefore functional status of our patients can change. So if the patient's ability to complete the transfer successfully is in question, it will always be the most safe to have the chair as close as possible. Prior to initiating the transfer to the bed, you should also consider the patient's potential to tolerate the transfer. Recognize that simply sitting up in the chair for a period of time can be fatiguing. The amount of assistance needed may be greater for the transfer back to bed than it was for the transfer to the chair. The patient should have a gait belt fastened around her waist and non-slip socks or shoes on her feet. Her feet should be also positioned flat on the floor. You may need to have the patient scoot forward if needed to position her feet appropriately. Scooting forward also helps her get her center of mass over her base of support. The patient's feet should be positioned about shoulder width apart to provide her with a more stable base of support. Next, to help the individual stand, have her place both hands on the armrest of the chair. She can reach for the hand grips of the walker as she assumes the standing position. Position yourself along the side of the patient, opposite the bed, so you are not in the way as the patient turns. You should hold onto the gait belt with the palm of your hand facing up. Instruct the patient to lean her trunk slightly forward and to push through her arms and feet to stand. As I help the patient stand, my feet are in a wide stance and I keep my back straight. I assist the patient up by using the gait belt to direct her center of mass up and forward on a diagonal. Don't simply pull straight up. This is uncomfortable for the patient and increases your risk for back injury. Once the patient is standing, make sure that both hands are on the walker. You can also quickly assess how the patient is tolerating the upright position by asking her, observing her facial expressions, and feeling how steady she is. Have the patient take small steps to move her feet toward the bed. She should push through the walker as she moves her feet, as that is the function the walker serves, to take some of the weight off of the lower extremities and also assist with balance. She should also move the walker along with her, keeping her feet inside the walker as she turns. Move along with the patient as she turns, staying along her side, keeping one hand on the gait belt and the other hand near or lightly touching the trunk or assisting in moving the walker. You'll notice in the video that I switch sides in order to stay close to the patient but not get stuck between the patient and the chair. When the patient feels the back of both her legs touching the bed, have her reach back with one or both hands for the edge of the bed as she slowly lowers to the sitting position. As you help the patient lower to the sitting position, you can squat down with your legs as the patient descends to help keep your back in a good position. Once the patient is sitting, move the walker out of the way. If needed, help the patient scoot back on the bed and remove the gait belt from her waist prior to assisting her into supine. If the patient has one leg that is stronger than the other, it might be helpful to have the individual pull the stronger leg back relative to the other one so that it is closer to the chair prior to standing. This position allows the stronger leg to raise the body most effectively to a standing position. Both feet should still be shoulder width apart. If the individual does not have one leg that is stronger than the other, positioning one foot posterior to the other is less important, but you should still ensure that both feet are shoulder width apart to maximize the patient's ability to balance once they are in standing. Also, when the patient is initiating the stand, you do not want the patient to grab onto the walker with both hands and try to pull themselves up into standing. Because the walker is not anchored to the ground, it is not a stable item that can be used to effectively assist them into the standing position. A compromise would be to have the patient place one hand on the walker and push off of the bed with the other hand.